Prepare confidently for your certification by understanding every component in this overview of the CNA exam, written plus skills test. The Certified Nursing Assistant, CNA exam is made up of two distinct parts, the written exam and the skills test. Each part assesses different aspects of a CNA's role and expertise in patient care. Understanding the structure, format, and content of both parts of the exam is essential for success. This lesson will provide an overview of the written exam and skills test, including what to expect, how to prepare, and practical tips for succeeding in each component. CNA Written Exam, Structure and Content. The CNA Written Exam is designed to assess your knowledge of key concepts related to patient care, nursing procedures, and safety protocols. The exam usually consists of multiple choice and true or false questions. Here's what you need to know about the written test. Exam format. Number of questions. The written portion typically contains between 60 to 100 multiple choice questions, depending on the certification body. Each question focuses on essential skills and knowledge necessary for a CNA to perform their duties. Time limit. You will have around 90 minutes to 2 hours to complete the written exam, depending on the test center. This time limit requires effective time management to ensure you can complete all questions. Topics covered on the written exam. The questions on the written exam cover a wide range of topics related to patient care and CNA responsibilities. Key content areas include basic nursing skills, knowledge of daily nursing tasks, patient hygiene, dressing, and assisting with activities of daily living, ADLs. Infection control, understanding how to prevent and manage infections, proper hand-washing techniques, and the use of personal protective equipment, PPE. Patient rights and ethics, the rights of patients in healthcare settings, including confidentiality, HIPAA, resident rights, and professional ethics. Basic anatomy and physiology, basic understanding of human anatomy, body systems like circulatory, respiratory, digestive systems, and how these systems impact patient care. Safety and emergency procedures, basic knowledge of fire safety, fall prevention, CPR, and first aid. Mental health and communication, understanding the needs of patients with mental health challenges and effective communication strategies for caregivers. Preparing for the written exam. To succeed on the written exam, you should 1. Study core topics. Focus on key areas like patient care procedures, infection control, and anatomy and physiology. 2. Practice multiple choice questions. Take practice tests to become familiar with the question format and time limits. 3. Review test-taking strategies. Use process of elimination to narrow down multiple choice options and ensure you read each question carefully. CNA Skills Test. Structure and Content. The CNA Skills Test evaluates your ability to perform key nursing skills in a simulated environment. Unlike the written exam, which tests your theoretical knowledge, the skills test requires you to demonstrate practical competence in real-life scenarios. Test format. Skills stations. During the skills test, you will be asked to perform 5 to 7 skills that are commonly required in a CNA's daily work. These stations are typically monitored by a test proctor who will observe your actions and assess your performance. Time limit. You will typically have 20 to 30 minutes to demonstrate each skill, with the total exam lasting about 30 to 60 minutes, depending on the testing center. Key skills tested. The skills test will cover a variety of essential CNA tasks. Some of the most common skills tested include 1. Hand washing. Demonstrating proper hand hygiene according to infection control standards. 2. Patient transfer. Safely transferring a patient from a bed to a wheelchair or from one surface to another using proper body mechanics. 3. Measuring vital signs. Accurately measuring blood pressure, temperature, pulse, and respiratory rate. 4. Assisting with ADLs. Helping patients with basic activities like bathing, dressing, feeding, and toileting. 5. Positioning and turning. Safely turning or repositioning patients to prevent bed sores and ensure comfort. 6. CPR or first aid. Demonstrating emergency procedures like CPR or performing basic first aid. Preparing for the skills test. To excel in the skills test, follow these tips. Practice hands-on skills. Perform hands-on practice with a partner, mentor, or during CNA training sessions. Focus on improving technique and speed. Know the procedures. Review the steps for each skill, including the proper sequence, safety measures, and any necessary equipment. Follow safety protocols. Demonstrate an understanding of safety precautions for each task, like proper use of PPE, correct body mechanics. Stay calm and confident. Practice staying calm during the exam. If you make a mistake, correct it immediately. This shows your ability to adapt. Commonly tested CNA skills. Here are some examples of the skills that may be tested during the skills portion of the CNA exam. 1. Measuring blood pressure. Properly position the cuff. Inflate and deflate while listening for the systolic and diastolic readings. 2. Assisting with mobility. Safely assist a patient in using a walker or wheelchair, ensuring they are steady and comfortable. 3. Providing oral care. Demonstrating how to clean a patient's teeth or provide mouth care for patients unable to do so themselves. 4. Feeding a patient. Assisting a patient in feeding, ensuring they are in a proper position to swallow safely. 5. Bed making. Demonstrating how to change linens while keeping the bed comfortable and clean for the patient. Summary of key concepts. Here are the topics and key points. CNA written exam contains multiple choice questions on topics like ADLs, vital signs, and patient rights. CNA skills test tests practical skills like hand washing, patient transfers, and vital sign measurement. Exam preparation. Study core topics, practice skills hands-on, and review test-taking strategies. Conclusion and recap. In this lesson, we provided an overview of the CNA exam, including both the written and skills portions. The written exam evaluates your knowledge of patient care, safety, and ethics, while the skills test ensures you can perform practical CNA tasks competently. Proper preparation, both theoretical and practical, is essential for passing the exam and becoming a successful CNA.